Hello everyone, this is question 16 over 100 clinically oriented anatomy questions. So let's get straight into it. The question says, upon removal of a leg cast, a 15-year-old boy complains of numbness of the dorsum of his right foot and inability to dorsiflex and invert his foot. Which is the most probable site of the nerve compression that resulted in these symptoms? Option A, popliteal fossa, neck of the fibula, lateral compartment of the leg, anterior compartment of the leg, and the medial malleolus. So let's go back into the question and check what the question says. So the major thing that the question pointed out was an inability to dorsiflex and invert his foot. So we need to establish that the compartment of the leg that is responsible for dorsiflexion is the anterior compartment, and the anterior compartment is innervated by the deep peroneal nerve. And then the compartment of the leg that is responsible for foot eversion is the lateral compartment, and the lateral compartment is innervated by the superficial fibular nerve. So where do these two nerves, where do they branch from? So the common peroneal nerve branches off into the deep peroneal nerve and the superficial peroneal nerve at the posterolateral aspect of the neck of the fibula. So the correct answer is option B, which is the neck of the fibula. Here is the correct answer, the neck of the fibula. So that is where the common peroneal nerve bifurcates into the deep peroneal nerve that goes to supply the anterior compartment responsible for dorsiflexion, and then the superficial fibular nerve that goes to supply the lateral compartment responsible for foot eversion. So let's check the other options and see why they are wrong. Option A is popliteal fossa. The major nerve that is in the popliteal fossa is the tibial nerve. That's the superficial nerve that is present in the popliteal fossa. So compression at the popliteal fossa is going to cause a compression of the tibial nerve, basically. And the tibial nerve innervates the posterior compartment of the leg, which is responsible for dorsiflexion and flexion of the toes. So option C is the lateral compartment of the leg. That is the compartment that is responsible for eversion and supplied by the superficial peroneal nerve. Anterior compartment of the leg, that is the compartment that is responsible for dorsiflexion and supplied by the deep peroneal nerve. So both of the compartments were actually affected. So that is why it is correct to say that both nerves were actually affected. And then the common point of those nerves is the neck of the fibula. That is the common point where the two nerves bifurcate from. That is the deep fibular nerve and the superficial fibular nerve. So they both branch off from the common peroneal nerve at the neck of the fibula. And option E is the medial malleolus. The medial malleolus is the downward prolongation of the distal end of the tibia, the medial prolongation of the distal end of the tibia, basically. And then the tibial nerve runs very close to the groove around the medial malleolus. So compression of the nerve that can occur at this medial malleolus is going to be the compression of the tibial nerve. And then compression of the tibial nerve at the groove behind the medial malleolus is going to cause loss of loss of toes flexion, loss of abduction, loss of adduction of the toes, and then loss of abduction of the great toe. So that is basically what is going to happen. Because at this point, the tibial nerve branches off into the lateral plantar nerve and the medial plantar nerve that goes to supply the sole muscles that are responsible for all the actions of the toes. That is the flexion, abduction, adduction. Of course, aside the extensions of the toes, because the extension of the toes is controlled by the anterior compartment of the leg. So all of that movement of the toes, apart from extension, will be affected when the tibial nerve is compressed at the groove behind the medial malleolus. So yeah, that is the explanation to the question, and I hope you understand, and I'll see you in the next episode.